Hello and welcome to India Top Doctor. Today we will talk about cholangiocarcinoma, also known as bile duct cancer. It is a very lesser known cancer in India, and to be aware about it is very necessary. So to know more about it, today we have a very special guest, Dr. V. Satya Suresh Atilli. Dr. Atilli Venkata Satya Suresh, medical oncologist and hematologist, has more than 15 years of experience in treating all kinds of adult and pediatric hematological malignancies. Dr. Suresh's talent was recognized across the globe with the prestigious and highly competitive Scholar in Training Award by American Academy of Clinical Research in 2006. So let's welcome him. So welcome to India Top Doctor. As you know, today we'll be talking about bile duct cancer. But before we move any further, can you tell us something about yourself?
So I'm Dr. A.V.S. Suresh. I'm a consultant medical oncologist and hematologist, chief of stem cell transplants working at Continental Hospitals, Hyderabad. And I'm having almost 2 decades of experience in treating various hematological and solid malignancies. And thanks for this interaction. Let's proceed.
It's my honor, sir, actually. Okay, so please tell our audience what is a bile duct cancer and how it is caused. Sir? Sir, I think there was a network issue from your side.
Yep. So,
should I repeat my question?
Can you repeat the question so that we'll just start from this and then just delete the other portion?
Okay, sir. So I wanted to ask, please tell our audience what is a bile duct cancer and how it is caused.
So cancer is a dysregulated thing. So whenever there is a out of regulation thing, then we call it as a cancer. So bile ducts are those things that carry elements that helps in the digestion of the food, what we call as a bile. So these bile duct cancers medically are called cholangiocarcinomas. So starting from if you imagine a tree, the root of the tree is common bile duct. So from there it branches out and then occupies the entire liver like the branches of a tree. So if it arises within the liver, it is called intrahepatic cholangiocarcinoma. And if it is outside, it is called extrahepatic cholangiocarcinoma. So these two are the things that happen. But if it happens at a junction, it is called Klatskin's tumor, right? So most of these cancers do happen whenever there is excess irritation and a failure to repair mechanism that happens in these bile ducts. Like there are some parasitic infections that will make the patients prone for these things. There are some viral infections that will make the patients prone for this particular cancer. There are some alcoholism and other things also will increase the stress to the liver. That also can lead to these things. So these things have to be taken out physically, what we call as a surgical resection. Whenever it is not operable, then it's an issue.
Okay, so there is one doubt and a very frequently asked question that can cholangio, sorry, I'm sorry for my pronunciation, can cholangiocarcinoma spread to the brain? And if it does, what percentage of the bile duct tumor can be cancerous,
Most of the things that you see in the bile ducts as a growth by default are bad in nature. Okay, so there are some characters that will pick it up, like retraction of the liver capsule, which are very, very classical in the CT scans. Sometimes you may not be able to get a biopsy, but even if you can't get a biopsy, if the characteristics are very, very unique, then you need to assume that they're cancers.
Okay, so how long does it take for cholangiocarcinoma to develop? And what is the life expectancy after people have been been caused with it?
So it's a very slow growing tumors. It takes typically few months to years for the cancer to start and then grow to a visible or to a size which can cause symptoms. This is what we need to understand. And second thing is, it all depends upon whether you can take it out or not. If you can completely resect it, most of the patients will have a normal life. So they don't have any major issues. Even if it is in a difficult to reach positions, liver transplants did help to cure these cases. But if it is inoperable, it is again classified into two things: inoperable because of local spread, inoperable because of the spread all over the body. If it is because of the local spread, by some means of treatment, you can just make them live up to 1.5 years. But if it is going all over the body, then that's a bad thing. 6 to 8 months is what the stage 4 life expectancy without treatment.
Okay, so can you tell our audience about the detailed information of how it is treated?
So we typically stage the disease using PET scan or any other imaging, see whether it is operable or not. If you can take it out, take it out. If it is inoperable, the next question comes, can I make it shrink by using some medications like chemotherapy or radiation or any focal therapy and then make it operable? Then what I do is I give something called neoadjuvant therapy, make it shrink and then make it operable, take it out. That's the ultimate goal. If both of them are not possible, then I'll try to control the growth of the disease with help of medications. Classically, we use capecitabine, gemcitabine, group of classical chemotherapy drugs. Nowadays, immunotherapy drugs and comb imatinib are the new combinations that are coming up. Phase 2 completed. So drugs with pembrolizumab with comb imatinib are known to produce very good responses. They are all immunotherapies. Latest entrant in the management of cholangiocarcinomas. So, best if you use a combination of these things, we look the patient into those who are good responders and bad responders. Good responders will do really good. Just give them some oral metronomic therapies. They will be living months together. Bad responders are a challenge. So we try to address the symptoms with help of pain relief with celiac block. I mean, we use various mechanisms. We try to drain the bile by using some stunting. So these are all the things that we usually do to comfort the patients.
So talking about the bad responses, is there like any other side effects that are caused after the treatment? What are the various kinds of
Yes,
side effects that are done?
the side effects is because if you take a part of the liver out, obviously till the liver grows back its normal size, the patient has to handle with the limited liver. So there has to be a lot of lifestyle changes that he need to undergo. Post radiotherapy, you expect strictures to form, jaundice to flare up. Post chemotherapy, you have the classical side effects of nausea, vomiting, and weakness. So we have antidotes for most of them.
Sir, again, you were stuck. Can you repeat the answer?
When I'm getting a phone call, I'm just getting it. So I think where did we stuck? I think we were stuck at a place. The surgery is done, radiation is done, right?
About the side effects.
Yeah, the surgery, when a part of the liver is removed, you need to live with the part of the liver until it grows. There has to be a lot of lifestyle modification that you need to undergo. Radiation is known to produce some strictures. You need to do stunting. The bile may get accumulated. Chemotherapy is having its own set of side effects like fall in the counts, nausea, vomiting, and we have antidotes for most of them. So we minimize the symptoms and let the patient have a normal life.
That's very good to know, sir. Anything like people can do beforehand to prevent it? Because we know how prevention is better than cure, right? So anything people can do to prevent, I mean, to various precautions they can take?
Two things. One is primordial prevention, another is primary prevention. Primordial prevention is change the lifestyle in such a way that you don't usually encounter the disease. The probability of disease happening will come down. like HPV vaccination is going to reduce the risk of cervical cancer. Like that, that's the primary prevention. Primary prevention is early detection. Unfortunately, there is no way how you can do early detection for the cholangiocarcinomas. So it presents, that's it. So you can't do ultrasound abdomen once in 3 months or 6 months, but we do recommend a screening of the liver on a regular basis, just to be on safer side. Primary prevention is there. That means where avoidance of viral infections, moderating the use of alcohol, taking a liver healthy food that is rich in fibers, moderate in proteins, low in fat and carbohydrates is the ideal combination. Some micro elements like zinc and selenium will help the repair of the liver. So these are small tips where people can just try to get rid of this dreaded disease.
Thank you actually so much for those tips. Yes, sir.
No, go ahead.
So you were talking about the lifestyle, food and diet is a very important part of that. So can you suggest what are the foods to avoid people with bile duct cancer?
High in fat, high in carbs, low in fibers is a bad combination. So try to avoid those things. Okay. And then just if you regularly do exercises and then just ensure the adequate supply of this thing, and then just take the last meal before 8 p.m. So that's what actually gives enough rest for the liver to metabolize. So, and then just maintain at least 2-3 hours of gap between munching. So these are the few things to reduce the stress on the liver. Obviously, when the stress is less, you have better chances of recovery, right?
Okay, I won't take much of your time, sir. My last question from you is any message you want to convey or share to our audience regarding bile duct cancer?
One thing is don't get afraid of this cancer, because people may get scared that liver part is removed and it is very difficult to regrow and other things. No, liver is having enormous capacity to repair itself. So be upfront for the surgery if at all surgeon suggests you. That is the only way where you can get cured. Try to stay away from more than 90 ml of alcohol per day. So I'm talking about 30% alcohol, right? And then just try to adopt a good lifestyle, good eating habits.
Thank you so much, sir.
Thanks, India Top Doctors, for giving the opportunity. Thank you very much.
Thank you so much, sir, for being here with us. Thank you. And if you guys want to book an appointment of Dr. Satya Suresh, you can do the same by visiting India Top Doctor. Till then, be safe and keep watching India Top Doctor.